Trans sex and relationships. This video is part of a series commissioned by Undeb Banga. Today we're talking about transgender sex and relationships. My name's Karina Williams and I'm a sex educator with Cwmni Addysg Crew Sex Education Company. This video will cover explicit and sensitive topics with references to sexual behaviour. So what does trans or transgender mean? It's important to remember that language changes all the time, so it's good to make sure that you're up to date with correct terminology. But at the moment, Stonewall say that trans is an umbrella term to describe people whose gender is not the same as or that doesn't sit comfortably with the sex that they were assigned at birth. So trans people may describe themselves using one or more of a wide variety of terms, including but not limited to transgender, transsexual, genderqueer, GQ, gender fluid, non-binary, gender variant, cross-dresser, genderless, agender, non-gender, third gender, bigender, trans man, trans woman, trans masculine, trans feminine and neutral. So if you're transgender, what might be different for you in terms of sex and relationships? You might find it difficult to have open conversations about sex and relationship. This could be through fear or experience of transphobia. Sex education and sexual health services might not feel inclusive of your needs. You might feel that you need different information or that you've got different questions that are more difficult to ask. You might be suffering from gender dysphoria and this can make intimacy difficult. You might be taking gender-affirming hormone therapy. This can have a positive effect in aligning your body's appearance and behaviour with your gender, but it can have side effects and promote changes which might make sex and relationships feel complicated or confusing, short-term or long-term. So if we're having sex, some general safety, things that we need to think about for everybody. So who are you with? Who knows where you are? Are you safe? What can you do if you don't feel safe? Communicate your boundaries, talk about what you want and what you don't want to do, and check that your sexual partner feels safe too. Consent. If we're going to be safe, we're going to need consent, so it's always your choice, but also the other person or people's choice too. Be sure that all parties are fully consenting to everything that you do together, and the absence of a no is not a yes. Nobody can legally consent to sex or sexual activity when they are heavily under the influence of drink, alcohol or drugs. We can't consent if we're asleep, if we're unconscious, if we're forced or coerced or tricked. We have to fully understand what we're agreeing to and agree within the moment at all points. So in terms of sexual health, what can we do to reduce the risk from sexual encounters? We can use condoms. So condoms are a barrier method which prevent unintended pregnancy and which prevent the transmission of most sexually transmitted infections or STIs. We can be regularly screened for STIs. We can do this by visiting our local sexual health clinic in the hospitals, or we can have the test and post kits delivered to our homes, or we can get these from the SU as well. I'm going to talk a little bit more about that later in the video. Pre-exposure prophylaxis, or PrEP, is medication which is available for people who are at higher risk of contracting HIV, and using this medication can stop HIV from transmitting between two people. Friction injuries and tears can increase the risk of STI transmission. So if we're having anal sex or if we're having sex with a near vagina, it's worth considering using water-based lube. So this will make things more pleasurable and will reduce the risk of cuts and tears. Also available in an emergency is post-exposure prophylaxis, which again is medication to stop the transmission of HIV, and that can be taken after a sexual encounter and is available through sexual health services. Also available through sexual health services, pharmacies, GPs, is emergency contraception. So contraception that can be used up to 5 days after sexual activity to prevent an unintended pregnancy. So health screening. It's really important that we undergo relevant screening for our body's anatomy, for the parts that we have. You will be automatically invited for screening according to the gender with which you're registered at your GP. So it's really important that you inform your practice if this is different to your gender assigned at birth, just so that they can invite you for the right screenings. You have the right to receive appropriate and inclusive healthcare. So you shouldn't experience any discrimination, and reasonable adjustments should be made to ensure that you feel safe and comfortable during any screening. You have the right to have somebody accompany you for any screenings as well if you want to. So hormone therapy and contraception. Taking gender-affirming hormone therapy can have long-term effects on your fertility. So if you would like the option to be a biological parent in the future, it's recommended that you explore your options before beginning hormone therapy. However, where a uterus and testicles are present, it is still possible for a trans man to become pregnant or for a trans woman to cause a pregnancy. Contraception should still be used for any kind of penis in vagina sex. Using a condom or an internal condom will have the additional benefit of protection from STIs. People who have a uterus and who are receiving testosterone therapy are still able to use progesterone-only contraception, such as the IUD, coil or implants. These can present the added benefit of reducing or stopping menstruation periods as well. So, can hormone therapy affect intimate relationships? According to Unique Transgender Network, yes, sometimes. So attraction can become more fluid, especially as hormones and anti-androgens can dramatically affect sexuality. During and after transitioning, attraction can stay the same. It could become more androgynous or bisexual. It may change to the opposite gender, or you may become temporarily or permanently asexual. If you're in a relationship, it will probably take time for your partner to get used to a new relationship and a new dynamic. It can take time to get to know each other again. Counselling might help this process, or it may be that changes in attraction do bring an end to an existing relationship. So here's some links to some sources of support and information. If you pause this video, you'll be able to click on these links and access these websites. Additionally to that, you do have a wealth of information and support with your student wellbeing service. They're located in the Student Centre in the SU. If you pause this video, you can click on the link or scan the QR code to access their social media and internet services. They can provide you with condoms, lube, dams, and they can provide you with the STI testing post kits that we mentioned earlier. So you can pick up a kit from there free of charge. BCUHB, Betsy Cadwallader University Health Board, are our local health board, and they provide sexual health services in North Wales. Again, accessible via the QR code or the link on this slide, and they can provide you with hormonal contraception, they can provide you with STI testing and treatment, they are friendly, inclusive and non-judgmental, and they can provide you with HIV services as well. So when we talked earlier about PEP and PrEP, this would be where you would access those services. Public Health Wales, again, another QR code you can access via the QR code or the website or the link. You can order free STI testing kits via post through this website. You can also order free condoms via post, and they've got a wealth of sexual health information for everybody. This is one of a series of 9 video presentations on relationships and sexual health topics commissioned by Undeb Bangor. They were designed and delivered by Cwmni Addysg Crew Sex Education Company.